అదే
ఆయన మాట్లాడాలి.
అంటే ఆన్లైన్లో కొంచెం వాయిస్ కనెక్ట్ అవుతుంది దీనికి ప్రొజెక్టర్ కాన్ అవుతుంది అక్కడ
15 minutes ముందే మనం చెక్ చేసుకోవాలి సార్. No,
Yeah.
Now it's పుష్పిన్ ఒకటి దొరుకుతుంది. CTA లోగో వెనకాల పడుతుంది.
It's already live.
right?
ఇంకో చైర్ వేసి పక్కన పెడదాం.
Suresh, can you test that live is going on?
అదే అనుకున్నా కానీ కనిపిస్తలేదు. చూసిన ఇందాక అంటే ఫుల్ కనిపించట్లేదు. అన్న కూర్చుంటారు కదా, బ్లాక్ అవుతారు. చైర్లో పెట్టి చైర్లో నిల్చోబెట్టండి.
ఇట్లా పెట్టండి.
అన్న ఆ చైర్లో పెట్టండి. ఇంకో చైర్ ఓకే
ఓకే
టెస్టింగ్
మీకు పంపించేసిన వాట్సాప్
పంపిరా. ఓకే థ్యాంక్ యూ. అది పాపం నేను పెట్టినాను బాటిల్ ఉన్నాను.
You guys having trouble connecting?
Yeah, good.
Oh, you guys got it?
Thank you. Presentation, can you check? వస్తుందా?
What was it?
లేదు, it's not screen mirroring. Yeah.
Oh, that?
No, that one.
That screen mirror. Can you?
Is it not working?
No, it's not working.
Okay, let me see.
It's the Wi-Fi. Thought the cable is connected, right?
What was it?
The cable is connected.
I think we need to go to that present wireless, that HTTP.
Uh-huh, yeah. Let's see.
స్క్రీన్ మిర్రరింగ్ యాపిల్ ట్యాబ్లెట్ చేయొచ్చు. అదేమో వైర్లెస్
And then if you just type in that HTTP 172.
పంపదన్నారా? సరే.
1651.
Yeah, you're gonna have to just download the Air Media real quick.
ఓకేనా?
వేరే లింక్
సరే పంప.
And just double click it real quick.
Got it. ఇదా? ఓకే. కనెక్ట్ చేశాను.
ఫుల్ ఫ్రెండ్స్ కావాలి.
ఓకే.
ప్రాపర్ ఉంటుంది.
మీరు ఇక్కడ కూర్చుంటారా?
Yeah.
కొంచెం జరపండి.
అది
ఇట్స్ ఓకే. అది కొంచెం జరిపేసి టీవీ సైడ్ జరపండి.
And then you just click agree.
యా సరిపోతుంది.
It just depends on how you want permissions.
the last once your session request penalty is always confirmed. Presentation
And
code
then code 0106.
010.
0106. Yep, and then connect. Oh no, sorry.
Oh, just-
Yeah, you click connect.
Okay.
Yeah. And then just click allow. There you go, and you're good. And then you can just go back to the slides and go to present.
Suresh, can you test on the live? Can you hear?
And there you go. Does that work?
Yep, that works. Thank you.
Perfect. If you guys have any questions, yeah.
Sure.
Thank you. You're welcome.
Okay, sir. Yeah. Good morning, good afternoon, everyone. welcome to a interesting and very important session today. Presented by Dr. Pawan and conducting by CTA, and CTA presidents are here, and the board, some of the people, board and EC are here. And first of all, thank you for conducting such a wonderful and very, very important session for this modern world, because we are we are seeing like many issues, due to the social activity or many other distractions, various reasons, people are facing the mental health issues. So Dr. Pawan Garu is going to discuss about this. Before that, I just would like to give an intro about Pawan. Pawan Dontineni, clinical assistant, professor, psychiatry at Ohio State University and Ohio University College of Medicine, board certified in general psychiatry, addiction medicine, and brain injury medicine. With saying that, Dr. Pawan, you are so valuable to our community, and we are very happy and love you to see here this afternoon, and would like to hear from you this afternoon. Thank you. We are very honored.
Thank you.
We are very honored this afternoon. Thank you.
Thank you, Ashok Garu, for the introduction.
Thank you.
Should we start? Yeah. Okay. Okay. So thank you everybody for coming here for discussing about the mental health problems in the Indian immigrants. This is such a broad topic. When I was asked to hold this discussion, I wasn't sure what to discuss, and because it is such a vast field, it includes so many mental health problems. So where to kind of focus and how to lead this discussion, I wasn't sure about that. We all know that we are in the epidemic of mental health problems. We've been hearing that since the pandemic, the COVID-19 happened. The next epidemic is going to be about the mental health problems. We all know that the mental health problems are increasing in all racial groups, all age groups. Nobody's exempt from mental health problems these days. But more so, the immigrant population is more susceptible for mental health problems because of some peculiar reasons, the particular reasons that are particular to the immigrant population. And even in that immigrant population, South Asian community, the people coming from the South Asian countries, especially Indian and that too South Indian community, are more susceptible for mental health problems. Why is that? So we'll discuss about some of the reasons. And when I was thinking about how to present this, this is not like a self-help or motivational or discussion about coping skills, that kind of a discussion, because that is not going to be of much help. I wanted to make it as because as the topic suggests, it's the discussing about the stigma associated with discussing about the mental health problems. So how can we make this as more of an awareness discussion, like how people can recognize the problems that they are suffering from could be a sign of the mental health problems. So I thought, maybe by discussing about some clinical case vignettes, like the kind of cases that I have been seeing here in Columbus for the last 10 years, if we discuss about some of those problems, some of the symptoms, then people can recognize as, oh, maybe this is what I have been dealing with, or maybe my family member is struggling with. I didn't know that it is a mental health symptom, and maybe we can get help, maybe we can improve the quality of our lives. So I will discuss some of the cases, but before we go there, some things I wanted to cover today, like why do we have to discuss about the mental health problems? And why is there an increase in prevalence of mental health problems in the South Asian community? And what can we expect for our kids, like the second generation immigrants, and what are they dealing with, how can we help them, and what they can expect or what we can expect from them, kind of. So when we talk about stigma, we'll talk about why there is a stigma about the mental health problems. People do suffer from the mental health problems because they don't seek out help. Stigma is a part of it. Stigma is not the whole problem. Stigma is like when you recognize that it is something, but you look down upon it, then that is stigma. If you recognize that, okay, I struggle with depression, but I don't want help because I'm weak. If I try a little harder, I can overcome this depression. Maybe that is stigma. But the bigger problem is unable to recognize some of the symptoms as the signs of mental health problems. That is the biggest problem I see in the Indian community. When friends or family, they call and they say that, hey, this is what my child has been behaving. When I talk about, oh, this could be like maybe ADHD or maybe anxiety, then they're like, oh, could be. And they seek out help and then they get better. So the stigma, uninformed is like they don't know what they are struggling with, misinformation, in the WhatsApp university these days, everything is like, everybody knows everything these days. So some of the misinformations or misconceptions we can try to clear up today. So let's, this is a friend's daughter from out of state. I did not treat the condition, but I wanted to talk about it. So she's a 15-year-old girl. She was a ideal kid until 1 year ago. Good grades, well-behaved, listens to the parents. Everything was going well. But 1 to 2 years ago, the problem started. She's been more irritable, talking back to the parents, isolating more to her room. And she was losing friends. Her grades were falling in school. More arguments or fights with friends, and there was this constant friction with mom at home because of her behaviors. Mom was thinking that she got the phone 1 year ago, and the phone is the reason for all her behaviors. She's spending too much time on the phone. She's not trying to get good grades. She's wasting her time. And so one day what happened was she was asked to take a shower. She went into the bathroom. She ran the shower. The parents who were outside, they thought that she was taking a shower. But when she came out, she did not. Actually, the mom found out, whatever reason, the towel was not wet or the bar soap was not wet or something. Then she confronted the daughter. The daughter kind of lied. No, I did. Some arguments started, and the mom slapped the daughter. So that created more behavioral problems from the daughter. Then the mom took away the phone, thinking that the phone was the reason. Then a week later, when they went to see the primary care doctor, her pediatrician, she told the nurse about, they have to do some screening about the abuse at home, those kind of things. And when she asked, like, do your parents ever put their hands on you? The daughter said yes. And the nurse got really alarmed, and she alerted the Child Protective Services. They got involved. It created a big mess. And when the pediatrician talked to the girl, so what she found out was like the girl had really severe anxiety going on, and about 6 months ago she started cutting herself, and to cover that up she was wearing full clothes, like baggy clothes, to cover all that up. And because of this anxiety and everything, she was kind of like withdrawing more and more from the parents. And she was, went through some other problems basically. So not to go into all the details, but then she was hospitalized after a serious suicide attempt, and then she was sent for a residential treatment program for 2 months. Then she got better after the treatment. So this is the cases that I'm going to talk about. This is not one particular case. This is one of the several of the similar cases that what I've been hearing about or what I've been treating, in the last 10 years here in Columbus. So some of the things that stand out here is like the poor communication with the parents. The daughter did not feel like she was comfortable talking about her anxiety to the parents, because whenever she was trying to talk about her problems, then the mother would jump to the conclusion that, hey, you're spending too much time on the phone. That's why you're having the problem. Then the only coping skill that the daughter had at that time was connecting with the friends. And the communication here happens with the friends through the phone. When the mom was taking away the phone as a punishment, like 1 week at a time, All her friends were communicating, organizing events and all that. She was left out. Then that kind of created more rift with the parents, with the mom. Then the daughter said she hated her mom because she was, instead of helping her, she was making it worse for her. And finally, the CPS, nothing came out of it, but there was a potential for a bigger problem with this. And the self-harm behaviors also, like 1 in 5 teenagers engage in some kind of self-harm behaviors in this country. It can be a transient thing for some people. They just make like superficial cuts. They overcome it when they find the support from the family or friends or something. But if they continue to feel lonely and not have that support, then that can become a more severe, that can escalate to a suicide attempt, or they can cut deeper. Unintentionally, they are thinking that they are cutting superficially, but that can go deep. And sometimes they bleed and they cut the nerves and all those things can happen. So the more important thing here is how we are communicating with the kids. Are we jumping to the conclusions? Are the kids feeling like they are heard? Are they understood? Are they supported? We'll talk about that a little bit more. So another case, this is I'm seeing it very commonly, like a 19-year-old male. He was very high achieving in school, got good grades, got into a good school, good college. And once he went to college, he was falling apart, kind of like more and more distancing from the parents, not discussing about everything. He started smoking cigarettes. The parents thought it was cigarettes. He was having more anger outbursts, lashing out at parents, like some pushing here and there also happened. And then eventually he started talking to himself. Like when he was alone, he was smiling to himself. He was like muttering something under his breath. He was kind of like talking to himself. Then they found out that he has been smoking marijuana heavily. Then not everybody who smokes marijuana is prone for psychosis, but it is becoming more and more common these days that people start hearing voices. They start seeing things when they are, using strong marijuana for long term. Then he also had to go to the hospital, get clean, start on the medications. Psychosis is something which is very serious. It's like one of the severe mental illness, SMI, what we call as. So was it really substance related, like the marijuana related, or did he have the underlying health condition, underlying mental health problem, or this kind of brought out the mental health problem? It becomes so complex after a while once they start using drugs. Even if they stop using the drugs after some time, the psychosis sets in and they have to be on the medication for the rest of their lives. Unfortunately, so many of our second generation Indian boys especially, they are almost everybody is using marijuana these days because the general opinion going on around is like it's a natural substance. It's been around for so long. It's okay to use, kind of. But not everything natural is good. And the kids who come to see me, they always argue about why can't I use it? It's legal now, like even the ex-president of United States say that it's safer than beer. Why can't I use it? Sometimes I give them the example like, let's say you don't have diabetes, I have diabetes. We go to the store, you can eat all the donuts you want. It is natural. I have diabetes, I cannot eat the donuts because it is not good for my health. Not everything is okay for everybody. The same way marijuana, if you have a mental health problem history in your family, if you're prone for mental health problems, it is going to bring out those mental health problems faster and stronger, and there is no way you're going back, kind of. And also the marijuana has been around for so long, but the strength of marijuana that is available now, even on the streets or in the dispensaries, it's like much, much, much stronger. It's not the same marijuana anymore. So one thing, if you want to discuss with your kids, stay away from this. It's never good for you. And so the more we got into this patient, he had attention deficit hyperactive disorder. It was never diagnosed because parents never knew that it is really ADD. He was struggling with inattention. So sometimes I hear that, okay, my kid is getting good grades, like he doesn't have any problems. How can he have ADD? How is this coming out when they are going into college? This can happen very often because when they are in school, the parents compensate for the lack of organizational skills on their part. You're doing everything for them, kind of like you take them to the classes and you make them do the homework, and you organize things for them. So you're compensating for the lack of attention problems by making them work extra hard. And some of the organization is taken away by you. But once they go to college, the courses are harder, and you controlling them from outside is gone. So the kids fall apart. They're not able to cope up with the stress of being in the college. Then what they do, they go out. The easiest coping thing is go out and smoke marijuana. The high it gives is going to make you feel better. And any substance of abuse, the drugs, they make you feel much better. They help you concentrate better initially when you first start using them. And then they're like, hey, this is helping me. Then let me use more. I have exams coming, so let me smoke this, and that will help me get through this exam. Then what happens? They cannot survive without it. The more and more they use, then the psychosis sets in, and it's much more of a bigger problem now. So this is, the example of the ADHD problems I was talking about. It is I kind of like focusing on the attention deficit disorder because it's very common, but very often missed diagnosis. And the kids are more inattentive. We are all Telugu, right? Asal vinipichukodu, that's what we say, the kids. They are more distracted. They are in their own world, kind of. And they're so hyperactive, they don't sit still. They are like walking around. All kids have a lot of energy. Every kid who has a lot of energy is not ADHD. But if they have like a few of these symptoms, they're very impulsive. They don't wait for their turn. They get into fights with other kids. Even in the class, when it's not their turn, when it is somebody else's turn to answer, they can't wait. They just blurt it out. Then they get into trouble because they're so impulsive, they end up saying things to other friends which are not appropriate, or they talk back. And they're kind of defiant. Even at home, if you tell them to do something, they don't listen, kind of. They want to do the opposite things. What we call as oppositional defiance disorder and ADHD, they go hand in hand, kind of. Sometimes we just say that, like, he's a difficult kid, and we brushed him off, kind of. But eventually, what kind of problems they are going to have by ignoring this is like the substance abuse problem. And because of the high impulsivity, they get into gambling, or a lot of them get into stocks and all that stuff, and they lose money. They're very accident prone. Once they start driving, that's when some of these symptoms come out. They get into accidents, they get speeding tickets, and all kinds of problems. And once they get into the substance abuse using drugs, then the other problems like depression, psychosis, they all come in, kind of. So it is better to have them screened if you suspect that somebody has ADD problems, rather than just ignoring and making it into a bigger problem down the line. So this, I didn't want to scare with this kind of, but if you look into the news, actually not all the cases are covered in the news, some of the high profile cases. If you heard about some of the cases like in Houston, Chicago earlier this year, the child, 26-year-old male, killed the dad or killed the mom at home, and now they are incarcerated. What's been happening? Like, nobody caught these symptoms coming. Like, how can suddenly things escalate to somebody being murdered there? So the standard pattern is like, the normal kids, 21, 22, then they start getting more disorganized. They drop out of college, or sometimes they finish college. They're not able to function well, like they don't have a regular job. They are staying at home with the parents, constant arguments with father. Then finally, like in a fit of rage, they pull out the knife, or if they have a gun at home, one of the parents or somebody at home is dead. Is it just a crime of passion or whatever, like in the heat of the moment, they could not control themselves, they pulled out the knife? Could be. Or they're delusional. A lot of them have delusional thought process, that is, in simple words, we say that that's what we say. But if it is just to an extent that they are able to function even with that level of paranoia or suspicion, that is okay. But sometimes they get so paranoid that my dad is trying to kill me, or the FBI is following me, my dad is scheming things against me, kind of. They're so stuck in their thought process. Then finally they give in, let me kill the dad before he kills me, kind of. So a lot of domestic violence cases or intimate partner violence, killing parents happens because of that. If somebody is starting to show these behaviors, instead of ignoring it, if we get help, start them on the antipsychotic medications, a lot of this can be avoided. So, and this is a real case that I have seen here recently. So, a 32-year-old female patient, very high functioning, has been very successful. Then she suddenly started talking a lot. Over the last 1 month, she's like non-stop motor mouth, kind of like talking, not sleeping well at night, going out, spending a lot of money. She was kind of like hypersexual, started having an affair. Then she was fired from the job because though she was working a lot, she was non-productive at all, because she could not finish a task. She would start like 10 different tasks, but she wouldn't finish any of them. And at home, fights because she was so argumentative, grandiose, what we call as like entitled feeling. Then they did not get help. She got a little better. They said, like she goes for some meditation or something like that, she would get better. The family sent her for the retreat, a meditation retreat. She got a little better. Did she get better because of that meditation retreat, or this is a bipolar disorder, manic episode? It can last for like a month or 2 months before they come down to normal again. We don't know if it came down. But the second episode came, it was more severe, and there were a lot of problems happening, the separation, lost job, and all that stuff. So if only they got help during the first episode, she started on medications, she would have gotten into less trouble as compared to what she's doing now. So another standard case we see back in India also. Since our childhood, we have never been taught how to recognize our emotions, how to identify our emotions, talk about them. If you're feeling distressed about your emotions, how to convey that and get help. It's all about get over it, kind of, like go for a more walk, go for a run, or go and meditate, go and pray, you'll get better. So all your emotions are kind of like getting pushed under the rug, you're forgetting them, ignoring them, kind of. But all those unpleasant emotions, they are not going to die out. They have to come out in one way or the other way. Some people end up having anxiety and panic attacks, or even if anxiety or panic attacks is sometimes frowned upon, if they're not supported, then they come out as unexplained physical health problems. A lot of middle-aged, like more so in the females, they have chronic headaches or severe back pain. They go for all the tests and everything is normal. Nothing is found on the tests. This is more so in the South Asian families. When they go for the primary care doctor also, some of them are not really culturally competent. They don't recognize this as a manifestation of a mental health problem. They keep on treating the pain medications, or some of these patients had even back surgeries also to relieve the back pain, but no help. They continue to struggle with the back pain. You get them into therapy, get them on the medications, depression medicines, they do get better. So what we call is the somatization, that is the mental health symptoms coming out as the somatic complaints, basically. So why are immigrants more prone for the mental health problems as compared to the people here in this host country? There are a lot of reasons. One is acculturative stress, that is not being able to assimilate in the society here. Two different worlds, two different cultural belief systems and everything. So there is a lot of friction. And by definition, acculturative stress is stress resulting from attempts to incorporate host country traits within one's own culture. This can take a toll on mental health, because there is always, we come here like when we are 30 years old, 25 years old and all that. By that time, some of the beliefs and the coping skills we have already set in, it becomes hard for us to assimilate because we have our own struggles going on at that time. And a sense of uprooting from our native land, a sense of loss, starting all over again at that particular age. And like we talked about, we have never been taught to identify the emotions or to deal with them. We are called the sandwich generation, like we are in between the younger generation taking care of them and the parents getting old. We need to provide care to them. So the stress of being torn by two different generations, that can take a toll on the mental health as well. The visa struggles, financial problems, less support for the child rearing. The young couples, when they have kids, parents come for 6 months, but that is, we need much more than that, basically, if we have to go to work and provide care for the children. Traditional gender roles, traditional family structure, discrimination, racism, we have to deal with microaggression. It's not really overt discrimination that we see in offices, but we can definitely see the microaggression, like saying some things which are not really nice, or like the getting the promotions, or getting into trouble at work. There is some discrimination. We cannot ignore that. And we see more of these problems in women. As such, the mental health problems are more prevalent, more common in women as compared to men, depression and anxiety problems. Because of the biological reasons, the hormonal changes and everything, and the postpartum, the childbirth takes away a lot of things from the mom. And traditional gender roles, coming from the Indian background, we expect certain things, what a woman need to do, what a man supposed to do. The ideas are different for people coming from South Asian community or the people here, kind of. That creates a lot of friction, and some people, that friction, they internalize that, and that comes out as depression and anxiety. Traditional family structure, hormonal disturbances, and lack of support. Empty nesters, like people in their late 40s and 50s, all the while they have a purpose, taking children to school, classes and all that. And now the kids are in college. They don't know what to do. A lot of loneliness, and the depression stems from there. Emotional pain always comes out as the physical pain that we talked about before. Men have their own set of problems, like they are supposed to be strong, provide for the family. They cannot look as weak because the kids are looking up to you. So when somebody is feeling like they're vulnerable inside, they need help, they cannot ask for help because they cannot be weak, kind of. And more people are relying on the alcohol as a coping skills or as a way to kind of like combat boredom. Second generation kids here, the problems, why do they have the more mental health problems? The statistics show that the second generation Indians have much more mental health problems as compared to the first generation immigrants. And out of the minority groups here also, Indian kids are more commonly having mental health problems as compared to the other ethnic groups. So some of the things is like they're not feeling connected to the parents. The parents, some of them are stuck in their own ways. The kids don't relate to that. The ideologies are different. The opinions are different. When the kids come home, there's a different world for them at home. When they go to school, there's a complete different world outside there. How can they kind of like combine these two worlds and make into one world for them as a one self kind of? So the friction between these two is causing them to be confused and have more of the emotional problems coming out of it. They don't feel supported. American culture encourages being more individualistic, more self-reliant. Whereas the Indian, how the families work is the structure of more of collectivism, family as a unit. There has to be some sacrifices that have to be done for the family unit. Whereas the kids cannot relate to that. It has to be more individualistic for them. And the hierarchical system that, like based on the age, sex, and the position in the family, like dad is the oldest, dad is the male. His word is the final kind of. Sometimes he doesn't have to explain, he will tell you, you just have to do. And the kids cannot understand that. Why? Just because you were born earlier, do you know more? No, probably I know more about this country than you, kind of. They don't listen. And the enmeshment that we see sometimes, the collectivism, the work as a family, the kids see as that too much of enmeshment, too much of drama. When there is drama, then there is arguments, fights coming. Then the kids get more drawn away from that kind of. So they feel more and more cut off from the family system because of the parents not adapting to what the kids exactly want there. And one of the problems is that the kids these days, they have high intelligence, they're very smart, but they're very low on the emotion quotient, EQ, what they are. They cannot understand the emotions for some other reasons. We don't understand emotions because we have always been taught, get over it, kind of. But these are very, I don't want to use the word entitled, but they come from a different frame of mind as compared to us, kind of. And a lot of overemphasis on academic achievement. Parents are always like, grades, you have to go to good school, not understanding what exactly the kids want or what are their limitations. They may not be good in reading or they may not be good in math. What suits them, what they will shine in, without understanding that, just keep on pushing. That creates the distance between the parents and the kids.
How about electronics? Playing always on the electronics. There's no impact of playing always on the electronics?
There is an impact, definitely. We were talking about a case where, like sometimes the parents assume everything is because of the phone, but the phones do play a role in the attention of the kids. Whenever you ask the kid to get off the phone, they do exhibit some irritability, like my daughter does that. I ask her to get off the phone and there is a temper tantrum, kind of. Setting the rules, strict boundaries. The phone is like even the social media that they are in, it's like a 20-second video. Every 20 seconds, you have a new video coming, new feed, new dopamine rush, kind of. So this constant spikes in the dopamine, then the attention span is going down. So it's like a artificial ADHD, not that they don't have the attention deficit problem, but they look like they have ADD problem, kind of.
Even movies also creating same thing these days. They don't want to keep the frames in the same sequence. They want to always
Fair.
changes to keep the audience will be
Yeah.
interesting. So that causes a lot of problems.
Right. So it is. The kids cannot handle a moment of dullness these days, like there cannot be boredom. When we were kids, the movies, there was not constant high throughout those 2.5 hours of the movie. There were like low moments, then the high moments and all that. But the kids, they want that constant high all the while. And the body can produce only so much of dopamine. Once it is depleted, then the depression problems, attention problems, anxiety and everything starts. But is there a solution to that? Probably not.
How we can avoid? Play outside.
I think Dr. Pawan is going to talk about that. See.
Yeah, if I have a solution for that, I would patent that and I would be a billionaire.
You don't have a solution, but you can slow down.
We can slow down. Yeah, just asking the kids to stop being on the phone, but what is the alternative? You have to give them the solution, okay, get them engaged in something. Sports is a good thing, or family time, you talking or going on drives with them. Board games, yeah. One thing kids lack is like they do crave for attention from the parents. They want to talk to the parents, but when they do talk, they don't feel connected to us. So just spending time with them, understanding where they come from, what is their world, what is their worldview, how is it different from us, learning from them, instead of always like in a teaching mode, sometimes learning mode with the kids, that can help. They are very smart, they do read books, like they all have book assignments to read in high school. We can read the book at the same time with them and discussing about the book. Or if they have an assignment about the US history or something like that, learning about that and talking about it. Need not be helping them with the assignment, it's just finding some topic to discuss with them, kind of.
How about listening music
It can help. One thing is it can give them like 30 minutes away from a device, just on the meditation thing. And meditation does definitely work. There are studies that show that even the chanting, the vagus nerve gets stimulated. That is a calming nerve in the body, and the chanting or the prayer or meditation that definitely help. But
we get to their level,
yeah,
to make them understand rather than asking them
Asking
to
them,
step
yeah.
into our world.
Mhm.
So that's the biggest thing, having the gap between the generation and next
Yeah.
generation and us. Because we were always told to be, do not ask any questions to the elders.
yeah,
And respect the elders, don't question them back, don't question their logic.
Mhm.
You have to follow whatever they say, dot the I's, cross the T's, that's it.
Right.
These generations, they would ask a logic, and probably we have to unlearn and relearn ourselves
Right.
to,
grow along with them.
Exactly,
Yeah.
because you never have a dialogue with them,
Mhm.
a quality conversation with them. Whether it's going to be a 5-year-old or or a 10-year-old, as they grow. And then I tell my kids the same thing is like, or my wife, a 5-year-old problem is equal to a 50-year-old problem too. Because if my kid loses their favorite toy and I lose, keys to my car, both are treated as the same problem because
Yep.
the world shattered.
Yep.
Yeah. So.
Yeah. So we think of their problems as small problems. Like
Exactly.
they say that I'm. Yeah.
Everything, low, right? We feel like, mine is a bigger problem because I am the eldest of the family, or I am the head of the family, or I earn more. I have the, we put a value to it.
Mhm.
It's going to be, tangible value or something, has a value. So we never understand someone with this problem.
Right. Pita kashal pitavi, sita kashal sitavi, like the same. If
How about food habits? Does food habits also anything really happen?
there is a strong connection between the mind and the gut. There is a lot of studies going on about the gut is called the second brain because the kind of chemicals and the receptors that are in the brain, like we could talk in terms of serotonin, dopamine, and all that stuff, the same receptors are in the stomach. If we are anxious, if we have an exam tomorrow and we are anxious, why do we have the stomach upset? Because the same chemicals are kind of like creating havoc in our stomach, kind of. So if something is going to affect your stomach, the kind of food that you eat, it is definitely going to affect your brain also. So food habits are very, very important.
And one big challenge I'm seeing nowadays is, it's an example of my son. So when he was elementary, he believed our culture. Now when he go to middle school, high school, he's not believing any of our Indian culture, anything like that. Even food habits also. He don't want to eat rice now. He's
Yeah.
like, no, there is nothing in the rice.
Yeah. It's a common problem.
Yeah, they don't like it.
No, all universities, I think, as a parent,
They want to go by the reason. When we were kids, our parents told us just go and pray. We prayed. Just do this ritual. We did it. We never asked about why we need to do it, and even if we asked, they would just slap us probably, just follow, But we cannot do it with them. They need to know everything, why they are doing. That is really good because you don't want blind beliefs. And maybe instead of just telling them, okay, just do this, why that is good for you. Like how praying can calm down your nerves, or how it is going to affect your vagus nerve, or all that stuff. Maybe we can take this as an opportunity to educate ourselves. Why is this ritual done this way, and try to explain to them. And enforcing never works for these people. If they say that we don't believe in it, I don't want to do it. By forcing them, okay, I don't want to go and pray every day after taking a bath. If you force them, it is only going to repel them more and more. Like leading as an example, if we want them to do it, we just going and doing it every day, they observe. If not now, maybe 5 years later, when they're in a different life situation, they understand the importance of it, and then they remember what we told them or what we did, and then they start doing it.
Most common phrase we get back is, you don't know anything.
Yeah.
But question back, right?
Really, we don't.
For all the screen time, we will stop forceful, but that will become a mental, the argument between the parents and the kids, right? How we can arrive, I know we don't have a correct solution, but what is the best practice?
It's probably always about picking the battles, like I am telling you, do it, get away from the phone, rather than that working with them about, hey, how about, like you get 30 minutes of this after you do this, or, you've been on the phone for too long, now your head will start hurting, or it's not good for you, let's do something else as together, kind of. Let's read a book together, let's go out for a drive, let's go to the grocery store, kind of. Creating something equally exciting for them, because if there is something exciting, they will probably listen. If there is no other alternative, if it is just like sit there, don't be on the device, what will they do? And when we're growing up, always talking about when we are growing up, but we could just go outside and we see 10 kids and we play with them. But it's not the case here. And all kinds of communication happen here on the phone with the friends. Then they feel disconnected. It's just about the time all the friends joined in, they are talking or doing something. Then when we ask the kids to get away from the phone, then they get angry because now they are missing out. The fear of FOMO, FOMO, fear of missing out what the other friends are doing, kind of. Okay. So there is less buffer for the kids these days. When they are going through the emotional problems, in olden days, it was more spread out. There were relatives, there were grandparents, there were uncles who can talk to. But here, the more and more they are having emotional distress, the more they are going to isolate themselves. And it is going to create more problems. So instead of telling the kids, just get up, go and do something, spend time with them, engage with them. Active listening is something which is going to be helpful. And as parents, we always try to correct them. When they come and talk to us about something, we assume that they are coming for our help to fix the problem. A lot of times they just want a sounding board, they just want to vent it out. Sitting there for like 30 minutes, 45 minutes, okay, whatever you are experiencing, whatever your point of view, just let it out. And before we start correcting them after that, maybe praising them for certain things, supporting them. My friend did this to me. Clearly it's our kids' fault that everything happened, but we are not going to say that. Hey, you did this, that's why this happened. Okay, that must have been very, very depressing is not the right word, but you must have been very distraught with that kind of supporting their emotions, because whatever they might be experiencing might be wrong, but they are really experiencing that. So us acknowledging that, okay, you are having a problem here, then you correct them, they take it better, kind of. So analysis paralysis, kind of like going into too much of discussion, kind of like, okay, okay, this is the problem, let's dissect it, let's discuss more and more about it, kind of. It's not going to work. I think that's all I have here. Any questions?
I think there are 4 or 5 takeaways.
No, I was just saying you need a few minutes break before we get into the question and answers.
Yeah.
Just take 5 minutes break.
A few minute break, whatever. Type in.
Okay.
That's definitely a thing to discuss.
Okay. There is a question. Forward just question.
Okay.
Somebody asked it.
We are planning a trip from a month before with all arrangements. It's a very specific question, I think, yeah.
Somebody asked for such
Okay. 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 Yeah, I'm good.
I think there are few takeaways what I understand from explaining all these things. There are 4 or 5 things that are very important factors. I just realized one should not fall into this category. Number one is I see a little bit of definitely a meditation involved, and we have to encourage kids to go more on activity-based stuff when they have time, and reduce the phone time, right?
Mm-hmm.
And healthy eating habits, and and also as a parents we need to develop the culture of listening mode rather giving a solution immediate, and these are the finite things I realized while you are explaining. Maybe we are missing some other stuff, so just to not get into this category, and by seeing all this, when you see all those symptoms, it's always better to contact psychiatrist.
Right. That's well summed up. Basically, using all the coping skills that as adults what we use is the same applies for the kids as well. Some extra things like active listening, trying to understand where they come from, being empathetic towards, like don't brush off as like, oh, this is a small problem. No, it is a big problem for them. And their world is different. They don't tell us everything that happens at school. They might be a little irritable that evening. Something might have happened in school, some friends' drama and all that stuff. So if we get into like why the kid is behaving that way and try to come from their angle, that might be helpful rather than, okay, you're angry today, you're not listening, let me take away your device, or you're getting a timeout kind of thing. And that kind of creates a chain reaction of my parent doesn't understand me. They're punishing me unnecessarily, and they get more and more away from us kind of.
And all these middle-aged guys, we have one problem we're facing. We see a lot of, there's a reason, there's a no reason. A lot of people want to be alcoholic these days.
Yep.
They will be moderate, they will be heavy, they will be like, all kinds.
Mm-hmm.
How does that affect you on the mental health?
It affects everything basically, like the alcohol depletes the brain chemicals. Normally, everything that we experience, happiness or sadness or whatever it is because of the interplay between different chemicals in our brain. They're all supposed to be in balance. When we drink or use drugs, some of these chemicals get released excessively at that particular time. Then you are depleted of those chemicals for the next few days. Then there is no way you will feel normal, happy, or like energetic. You feel tired the next day. When you're younger, the body can compensate, like it can produce chemicals faster, but after that it's gone. Actually, I wanted to mention about one case, like a young, like 40s. He was a very active guy, doing things around the house and, like very active with the kids and all that. Then he started kind of like feeling a little low, relying more and more on the alcohol. Then he was not spending time with the kids, more irritable, anger outbursts started happening. Then when he went to see the family doctor, they put him on an antidepressant, got some improvement, but there was not much. Finally, what they found was his sleep apnea. Sleep apnea is like when you are sleeping because of certain obstruction in the airway, you don't get enough oxygen to your brain, basically. You snore. Number one sign is snoring. Very common in middle-aged men, especially us, because of the high BMI kind of obesity. And sleep apnea puts you at the higher risk for depression, and alcohol makes it sleep apnea worse, kind of. So if you're already prone for sleep apnea, you're drinking on top of that, you might have noticed that, like when you're drinking, you're not getting refreshed sleep, like as you're getting older, because your brain is stopping breathing in the middle of the night and it's not getting the energy that it needs, the oxygen kind of. Then you get depressed. And if you keep on doing that for long, then depression sets in and then you will have to be on the medicine. So,
But I mean, so far we have focused and concentrated heavily on like the kids oriented. Right? We are away from home, most of us. And just if somebody, most of them will not have siblings or immediate family nearby or anything. So, and we tend to invest heavily on our kids, right? Like we want the best for them. Purely on them. Everything revolves around them, right? Like going around and coming back, taking care of them. How do we balance it out so that we get enough time for us so that we will not have a problem in the longer term? Right? Like you said, when the kids go out, it's an empty net for us.
Yeah. Yeah, it's a very big problem when we were talking about how the Indian family structure, the collective framework, and the generation here is like more individualistic. We ignore our personal needs. We ignore our health because we have to do something for the kids. Everything is centered around the kids, and finally they are out of the house, and then we are like left with empty bank balance and poor health and boredom and everything. That's why CTA is there, to kind of like engage more in the social events and build up your social circle. Yeah.
Absolutely. Now, like, that is also an important question, right? Like taking time for ourselves.
What is that?
Taking time for ourselves.
Taking time for ourselves, yeah. Personal time. Invest.
Community service,
Mm-hmm.
right? And how about the exercise and yoga and how much that's helpful?
That's very, very important, because yoga is, not only the physical endurance, but also stretching. That helps with a lot of, like the physical agility and everything. So the older you get, the muscle mass is going to decide on how well your balance is going to be, how well, you're going to be active and all that. So anything that improves your physical fitness in the younger age, that is the time well spent, kind of, more than anything else. And meditation, it's always, the dementia is also a big problem right now. As we are getting older, depression or loneliness puts you at higher risk for dementia. As we already can see, we are forgetting things, like where I put my keys, or, what is the name of that friend, we completely forget, So if you catch that happening to you, then the more you focus on that, the better. Because once you forget things and once you develop dementia, then things are going to go down fast.
Even stress, right? Stress is the silent killer. A lot of people, being active, physically fit, doing everything, but dropping dead in their 30s or 40s. And how do you factor that in? Because people are not, they're talking, but they're not communicating enough or not having the closed, trusted confidant to talk about their problems. Because they might be having peer pressure or identity crisis, something like those, because this is where the first generation
Right.
Indians do face that. And if I tell I have a problem, maybe my friend, I feel like, I'm belittling myself in front of them. And those kind of things, how do you, help them navigate?
Yeah. Like you said, we are talking, but we are not personally connecting with anybody these days. So making good, meaningful friendships and relationships is going to be helpful. I can talk about two things here. One is there is something called the Harvard Happiness Study. they followed, this study started like 50 years ago. They selected a group of like, I think, 1,000 students at Harvard University, and they followed them every year until now. Like who remained happy, who were successful, and all that. So the study is still going on. They talk to the study members every year, their kids, their grandchildren, their spouses, and everybody. What they found that was people who are successful in the long run, they don't have like high paying jobs, they don't have like hi-fi big houses or everything, who are more connected to their roots, who are more connected to their friends. They meet their friends in the evenings or the weekends kind of. They are the ones who live healthier longer and who are more happier. The risk of dementia is less with them. So the more you can go out and spend like in-person communication with the friends, that is better rather than being on the phone. Meaningful. Just not just a superficial, like, what is that?
With
Less alcohol, yeah. Maybe more water, less alcohol. Yeah. And there is one other study actually. There is a sociologist, like he studied this. There's a book by Malcolm Gladwell. He writes about all these patterns and everything. I think the book is called The Outliers. So there is a town in Pennsylvania where they found out that the risk of, like the people have less number of heart conditions or cancers or everything, you know, like they wanted to study why that particular village doesn't have any heart related conditions or deaths or anything like that. They thought they have very healthy lifestyle. Maybe they don't smoke, they don't drink and all that. Coming back to alcohol, So they thought so, but one sociologist wanted to go there and study. He went there. He was surprised to see that everybody was smoking there. Everybody was drinking there. Nobody was exercising. Everybody had big bellies and, all kinds of bad habits they were having. But still they had good health outcomes. So what they found out was that everybody in that community came from the same village background from Italy. They all immigrated from there. They all stayed there. Their families kind of stayed there. Everybody worked during the daytime in whatever jobs they are. In the evening they came and everybody would sit together, socialize, laugh, smile. They have a couple of drinks and all that. But they were socializing so much and they were laughing and they were in good moods, not stressed out. So,
living a happy life.
yeah.
They're not missing their roots.
Yeah, stay close to the roots and spend time with the family and friends, and that takes away all the stress. Keep it simple, yeah.
They're not Amish, right?
No. Yeah.
Yeah, like, so there are so many things, like broad spectrum when you talk about mental health. There are people with microaggressions, people have episodes, they don't even recall that, they had an episode. They just blurt it out and then they don't realize what happened. And they do already cause the damage to the other person, but they don't think that they initiated it. But when when the other person starts to, put them boundaries in everything, and they start to create their own narrative about that individual. So that's, you often see, everywhere.
Yeah.
How do you,
There is no excuse for being rude to people. Sometimes they say that, oh, vad madatire anta, but that's not an excuse. There is no, they say that the words hurt more than, the knives and all that kind of, yeah. So,
being kind is free.
yeah, just staying away from those people, or sometimes, letting them know how you feel, when you talk to them. Yeah. Somebody was asking the question, I think the other day, like, what is intergenerational trauma? How does it affect people and all that? It is a big thing. The trauma and how people react to it and how they behave is a, big thing which is ignored often. So let's say if the dad grew up somewhere in the village in India, poverty, or his dad has anger problems, then he develops certain behavioral patterns which are not really good. Like he can have the anger problems, then they come here, and when somebody has anger problems, they are going to create some dysfunctionality in the house. We call certain things called the ACEs, adverse childhood events. if the kids are exposed to some of them, the long-term outcome of the mental health or the physical health is bad in them. Some of them are like, if they lose a parent in their childhood, or one of the parents is incarcerated, or they're exposed to physical abuse at home. They need not be the victims of the physical abuse, but if they're just witnessing physical abuse, if mom and dad are yelling at each other, like anger outbursts and all that, if they're witnessing, then that trauma of the dad or mom is getting onto the kid, and that becomes their trauma, and that kind of like keeps going from the generation to generation. Because the physical abuse is a lot of times learned behavior. People who witness abuse go on to abuse other people. So it's like breaking the what we call as the generational curse or generational trauma. Rise up, understand your problems, fix them so that it is not getting propagated to the next generation. Questions? Okay. The ones you sent me, right? Yeah. Okay. You want to read?
It's okay. You can. If you're okay, you can read.
Yeah, that's fine.
Yeah.
So one question somebody asked is like, mental health is still stigmatized in many Indian communities. What are effective ways to start conversations with family members who may not believe in therapy? So if you're talking about a family member who you think needs therapy, the question is, why do you think they need the therapy? A lot of times it is used as something against them, like if somebody does something that you don't like, you are like, you have bad behaviors, you need therapy, as if like we are insulting them or something like that. So we have to put it as like therapy is something that can be helpful, not as a, like as a fix for your bad behaviors. And like I can give an example for, my friend's son, a teenager, he was having some behavioral problems. They were talking to him, you need therapy, you are having these problems, kind of. He was not listening because he was thinking that the parents were not understanding me. They think that I have problems. They are making me kind of like the victim mentality kind of. Then we approached it as like, it is the parents' problem that they're not able to understand you. Can we go for the therapy, all of us together? That way we can understand ways from the therapist, how we can communicate with you or relate with you. We can improve our communication skills. Then he took it as like, maybe my parents need some therapy about improving their communication skills, and he agreed, and they all went for the therapy together. So if you think a person needs therapy, it could be the individual problems, like if they're feeling depressed or anxious, or it could be something like more severe. Or a lot of times when people ask for therapy, it's like the interpersonal communication skills lacking, like they are coming from one way and these are coming, they are never meeting in the middle. So if they sit together with a therapist in a non-judgmental room, and the therapist acting as a moderator, like they come on the same page, and then they can, improve their skills. So the second question is, how can second generation Indian Americans balance cultural identity with personal autonomy without feeling guilt or isolation? I think we addressed that about, like how the Indian family framework works and how the next generation, the more individualistic approach. It's always meeting in the middle, kind of. Are there culturally specific signs or stress or burnout that may be overlooked in Indian communities? Yeah, there is definitely the culturally specific signs. We were talking about the somatization. Like many of the Indians are not going to talk about, I'm feeling depressed or I'm feeling anxious. They are always going to talk about, I have back pain, I have headaches, I have stomach problems. And if we sit and talk about, like go deeper into it, then we find out that, okay, like the case we were talking about, her mom passed away 2 years ago, but nobody really cared to look into like her symptoms started, her back pain started after that. All the tests are normal. And a lot of times the primary care physicians don't have enough time to talk about, like, okay, what is going on with your life, kind of. then the family has to understand, and then maybe therapy can help with that. The next question is about the intergenerational trauma that we already talked about. Oh, that was a very specific question about the child not wanting to go. So it all depends on, how old the child is, taking their wishes into consideration. Is it like a big birthday party, like is it the 16th birthday party or, 18th or whatever it is? And if the child is shutting off, doesn't want to talk, again, it's like having understanding communication with them rather than like talking in the language that the kid doesn't understand. A lot of times the kids don't, like we talked about, they don't relate to the parents, or they don't understand the importance of why the parents are doing this. Explaining it about the importance of why they have to do this and what are the reasons behind that. Having, without distraction, one-on-one discussion, take out time for 1 hour, go on a drive and talk about it. They have to talk about it during that time. That can be helpful.
Why do kids chew on clothes when they are alone?
Vitamin deficiency.
Yeah, iron deficiency, yeah.
I never chew my clothes.
So you're a good boy, huh? So chewing clothes, like how bad it is, how severe it is. Again, like people are sometimes bored. Some kids need constant sensory stimulation. Understanding like why do they need that? Why are they getting easily bored? Why do they need that stimulation? If it is like just small habit, they will overcome it. But if it is like keeping on like all the clothes are wet or they're tearing clothes and all that, then we need to look into like there is some underlying pathology going on there.
I think just like the nail biting, like some people.
Nail biting also, yeah. Sometimes it can be a manifestation of anxiety as well.
Fidgeting, poking up,
Yeah.
A lot of kids do fidgeting or they move their feet or hand, all the time.
Yeah.
Try to calm down.
It's a restless energy. All kids have some restless energy, but if it is not being dysfunctional, one of the symptoms of ADHD, attention deficit hyperactive disorder, is they have so much of this energy that they have to spend it some way or the other. So recognizing the other behaviors along with this, not taking it in isolation, can be helpful.
Yeah, I have one question to you. So, being a psychiatrist, right? So, how do you overcome your stress or your anxiety? And how do you balance yourself every day?
I get my therapy at work.
So, do what you
You
like.
practice before you preach.
Yeah.
Absolutely.
One question. So, young kids, they cry. So, it's a way of telling or talking to my younger one. She'll be fine, but she cries for most of the things. How do cope up with such kids? Even though I say like, if you want something, ask, but she starts with crying. So how
old is the kid?
She will be 5 in August.
Okay. So crying is a form of communication for a lot of kids. If they're not able to effectively communicate what they want, then they can cry. Not every behavior has a psychopathology behind it. Some behaviors are just there, the behaviors kind of. But anger, like if we are talking like two people, one person gets angry because at a point he cannot communicate anymore. He doesn't have answers, or he doesn't know how to kind of like keep on that communication going. Violence is an answer when there is no, reasonable kind of thing. So if the kid is not able to put in words what they want, they're stuck with that, like I cannot express myself, then they have a temper tantrum, or the crying or whatever it is. And sometimes if they're not getting the positive attention, they go for the negative attention. If I'm not saying you do that, I'm talking in general kind of. If the kid is not getting that attention time from the parents, how will they get the attention when they do some bad behaviors? Then the mom or dad will come running towards them and give some attention kind of. So we need to look into like, are they getting enough attention, or is there a communication problem going on there, or bad behavior, that's all.
So, coming to, I know this is like a wide subject, but being in other, right now, as we spoke earlier, also like 30s and 40s, we have been hearing too many cases now. I mean, it could be related to stress. I know hormonal, ancestral, like from parents, the heart attack rates, cardiac arrests are like, could be minimum in that, but most of our like tend to stress or anxiety or whatever. So is that true? Like,
It is, the stress can be the reason behind a lot of physical health problems, heart problems, cancers, easily prone for infections and everything because of high cortisol levels, the stress hormone that is going on around. There is, these days we are feeling like being chased by an invisible lion. In 3,000 years ago, 4,000 years ago, when people were living in the forest, if there was a lion or something, then how the body will go into like a fight or flight mode. They have to escape from the lion. So what happens? Their heart rate goes up because the heart has to pump out enough blood to all the muscles so that the muscles would work to run away from that situation. They have to breathe faster because they need more oxygen to run, kind of. These days we think that there's a lion chasing us. So we are always tensed up, our muscles are tight, our heart rate is high, we are breathing, superficially and rapidly, kind of. So body cannot sustain that for too long. So you have to find ways to calm yourself down.
is there any change with AI impacting humans? Is there any study that already came up to you guys?
So obviously job stress is there for a lot of people. That creates the anxiety, and with the AI, as humans, we are social animals. We need that personal connection with other people. So that is going to go away. Everything, AI can provide me with everything. I don't need to go out to the library to find a book to find something, or ask somebody for, like, what is this, getting advice and all that. But everything is there at our fingertips with the AI, then we are going to become robots. And the intimacy problems, and the younger generation they don't want to get into like relationships or dating or marriage because they don't need the feel for it. They are like, for the happiness that comes in with that commitment, I have to put up with so much of drama. They don't want it anymore. And now their friend is like AI. People can just talk to Grok instead of talking to your friend.
Well, AI is creating opportunities, and AI is trying to make humans robots, and robots are making humans.
Once we start implanting emotions into robots, it's gone, right?
You're right. The neural technology now that they're trying to be like robots, like going to behave like humans, and all these field humans are going to behave like robots. Probably you will not see the whole difference between humans and robots, eventually.
There's no humans, robots
Yes,
are no
exactly.
Yep.
So, but out of all these, my question is, how is AI is going to impact on the mental health? I think that's going to be huge and amazing due to the way things are developing, around the world.
Mm-hmm.
So, what is your suggestion on that? What is your opinion?
So I will never be out of job. More and more mental health problems in everybody. Yeah.
Absolutely, I'm seeing that.
So there were some the AI counseling apps that came. Like if somebody is feeling depressed, instead of talking to somebody, they can just talk to or type in with the AI apps, kind of. But the outcomes are not good at this time because there is no personal relationship, and some suicides have happened when somebody said, I want to kill myself, and the app encouraged them. Okay, it was rationalizing, it was coming with like the not the good solutions, and the kid went and committed suicide, and then it became a problem.
OpenAI got sued for the same reason that it provoked the kids, or
Yeah.
Or pushed the kids to commit themselves.
Mm-hmm.
Yeah.
All of those things. Yeah.
going forward, the jobs, psychiatrist jobs are very good, like whatever I am hearing.
Will be increasing.
They have demand.
Yeah. Good.
You want to say something?
No, we covered everything, I think, right? Important.